everyone. Grab your coffee. I'd say grab a blanket, but it's not even cold. It is so wet and sticky here today. It is a little bit gross. Hey everyone that's joining. We are chatting all about pain today, and specifically pain in kids, obviously, but more about why it's so challenging to understand pain in kids and why it's hard for us to recognize pain in kids, how we can help them. It's a really complicated topic. You'd think, oh, pain, fine, easy, but it's so much more complicated in kids. So yeah, I'm keen to chat. Hey everyone. I'll just wait for Kim to, here she is. Great. Funny story, Kim and I started out as brand new baby nurses together way back in the day, and our paths have now crossed again. Hey Kim!
How are you going?
Good. I was just saying we were baby nurses together, and then as in like new grad nurses.
Yes.
And then we went separate ways with other careers and work, and now our paths have crossed again, and I'm so excited.
I know. It's so nice to be back in the same state and town.
Yes.
And everything. Yeah.
I know, we just missed each other because I think I was in Victoria before you, and then I was back up here when you were there. So anyway, we're back together now.
I know. It's lovely. Thanks for having me.
I'm so excited to have you here. I was just saying before you jumped on, like, pain is such a complex topic. Like, it seems really easy, but it's really complicated because there's so many different things at play, and it's no surprise that parents find it difficult to navigate, because so do we as clinicians find it really challenging to navigate.
Absolutely. And look, unfortunately, we know historically that in hospitals we don't often recognize pain very well or treat it very well. Not good, and there are lots of things happening to help change that, but it's so complicated, it's so multifactorial, which we'll get into. But
yeah, for sure. Well, do you want to tell everyone who you are and a quick little rundown of your background and why I've kind of got you here to chat about pain? You're like the pain girl, but do you want to tell everyone why?
So like you said, Pen, I started nursing with you in our new grad days. It was probably about 11, 12 years ago.
Yeah, it was a while.
Been a while. We're in peds ever since. Did most of my career I've been down in Melbourne working at Royal Children's Hospital, which is an amazing facility.
Fantastic.
And I managed to sort of find my spiritual home of nursing in emergency. So that's sort of where I really loved to work. But sort of more recently in my career, I was given the opportunity to join a pain team and work as, I think that paused. So I was working as a clinical nurse consultant in a paediatric pain team in procedural pain. So that was really helping children cope with things that we do to them in hospital, which quite often can be painful procedures, unfortunately. So we would work with anaesthetists and with other nurses and with child life therapists, who might also be known as play therapists. And we work together to help children cope. So whether that's with lots of non-pharmacological strategies, of course, but sometimes in hospital we can offer pharmacological options to help, of course, reduce pain, but also maybe reduce fear and anxiety as well, which can be equally important and absolutely interwoven into our experience of pain. So that was the role that I was working in, which was absolutely fantastic. And then I had a bub and I moved home to Newcastle. So
which is equally as fantastic.
Absolutely. Lovely to be back. So
I'm sure that's a little bit painful too, having the son, and it's all it's a whole different emotional pain.
Exactly. Absolutely.
Yeah. I find that so interesting that you mentioned that fear and anxiety play so much into pain as well. Like I only was chatting in my stories yesterday about health anxiety and how it's super common for parents. That context was in vomiting and gastro. It's a big trigger for a lot of parents, but pain as well, like how we act can impact on our child's perception of pain too.
Absolutely. And, you know, children are so clever at picking up on our mood, our anxieties. And gosh, I know this as a parent, even with things like jumping on an airplane with my kid. If I'm nervous, I mean, back in the day when we used to fly, you know, if I'm nervous, my little boy would feel that. It absolutely really impacts upon their mental state as well. So I think, you know, this is the sort of never-ending thing about being a parent. It's trying to somehow ground yourself and center yourself and calm yourself to be able to support your child. But look, we all struggle with it.
We're human.
We're human. No one wants to see their child in pain. Absolutely. So it's really difficult, but it's a really important thing to reflect on how you cope with pain as well. And look, I'll be the first one to say, when my little boy gets his immunizations, I recognize that I can be a bit more anxious than my husband. So he might do the holding while my little boy has his immunization, and maybe also the sort of control freak nurse in me might sort of want to come out and try to orchestrate how he's being held and everything. And my little boy doesn't need that at the time. He needs his parent. So we might do something like Dad holds him to the immunization, and then I get to have the nice cuddle at the end.
Yeah. Whatever works, really.
Exactly. Whatever works. And it's about knowing, you know, as a parent, do you have a massive phobia of hospitals or needles? And, you know, how is that going to impact on your child as well? So,
And part of your role would have been in situations where, let's just say, a child's been in hospital for a while and, you know, you're anticipating that they are going to be having some painful procedures or whatever the scenario is. That would have been part of your role too, wouldn't it? Have been like chatting to parents, carers, who's there, what's going on, to try and work out how to navigate the whole.
Absolutely, because that child exists within a family context, and that is so important, that we're not just focusing on the child, we're involving the parents, we're empowering the parents, and listening to them as well. No one knows your child better than you do. You know, when we're looking at non-pharmacological coping mechanisms.
So the non-medicine.
No medicine. What I'm talking about are the sort of, you know, things like distraction. I don't know if your little boy loves Bluey or does he love Bob the Builder, you know, things like that. You know your child, you know what they enjoy, what they engage with.
Or even things like hands-on or hands-off. Like, do they like that cuddle, or does that stress them out more? Or,
Absolutely. You know implicitly so many things, all these things about your child, and it's really important for clinicians to talk to you and to create a game plan as a group. It's not just about what we are going to do to the child, it's about how mum and dad and everyone are going to be involved in that process and support the child. But
which is
parents,
I was just about to say that's another reason why it's so important for parents to speak up. Like I've been the parent and the nurse on both sides in hospital, and of course you see so many times you're like, parents will be, honestly, whatever you think is fine, like, we trust you, and that's wonderful. But if something's going ahead where you're like, I really don't think my child's going to respond well to this, like, absolutely speak up. Be like, oh, I'd actually prefer it if I was on the bed, or, you know, whatever. Like, you can absolutely speak up. And would you say that if there's an issue with that, you'd be able to talk about ways to get around it? But we want parents to speak up, right?
Absolutely. You need to feel heard and involved as a parent, because if we don't have your buy-in, it's going to be really difficult to have the child buy in as well.
Yeah, totally.
And also, I think to just mention, there's also no shame at all if you feel that you can't be present during a procedure.
Yes.
That is really normal. Nurses and doctors won't be judging you.
Yeah.
You know, maybe a common example would be a lumbar puncture, which
I was about to say the same thing.
absolutely, it's a test that can be really critical, and you know the children that we're doing this on most of the time are very unwell,
Mm-hmm.
life-saving medications, and a lot of times antibiotics.
Mm-hmm.
But I'm not going to deny that that's not a procedure that, as a parent, wouldn't be really,
Awful.
yeah.
Mm-hmm.
But so know that there's no shame if you feel that you're going to really fall apart, which is understandable.
Mm-hmm.
This might be an opportunity that you go outside with your partner and sort of have a deep breath together, have a cuddle, and know that the nurses and doctors in that room will be doing everything in their power to comfort your child and to make it
Yes.
as pain-free as possible.
Absolutely. Yeah. And then you can be there afterwards to have the cuddles and the
Yep.
reassurance because, yeah, so many times we did this in emergency and even comments from parents in posts and things that I've done that have said, I still think about that day
Yep.
and it is traumatizing for them. And then obviously there's other parents that aren't bothered by it at all. And neither is better or worse. It's just different perceptions and how sensitive and all of that sort of thing. But yeah, you're so right in that if you can't or don't want to be there, it's
Yeah.
okay. Absolutely okay.
Absolutely. So yeah, that's a really good point to just make, to just don't feel ashamed, but also don't be afraid to really advocate for what is going to help your child.
Yeah, for sure. So do you want to let's take a couple of steps back and let's chat about what is pain? Like it
Sure.
sounds really obvious, but it's actually a little bit complicated. So what
Yeah.
is pain and why do we struggle to manage it or recognize it? Like what's going on there?
Look, pain is really subjective. And what I mean, every single individual will experience and express pain differently. And that, that's because of a range of factors. Pain is not just about the physical, painful stimulus. It's really wrapped up with the psychological component of how, your fear, anxiety, your coping mechanisms, your life experience. So absolutely psychological aspects, emotional aspects, contextual, so where you are. Like, how many times have we seen our kids just fall over at home and have a little cry, but they're in their familiar environment. They come and they probably recover a lot quicker than if they were somewhere that they weren't familiar with, or if they were in hospital where they're really afraid. So all of those things really impact, the culture of your family, that you've had as a family to do with pain. That all feeds into how complex it is. But add upon that in children, quite often they're not able to talk to us about how they feel, whether they're non-verbal, they're babies, they're not able to articulate what's
where
going,
it is, what it feels like. Yeah.
what it feels like, how bad it is. And I don't sort of want to say how bad it is. Like, I think people can feel, when we do that scale of 0 to 10, a lot of people would have heard 0 being no pain at all, 10 being the worst pain you can imagine. As clinicians, we're not sort of trying to test you, and we're not coming from a place of not believing you.
Or saying you have to be at this number to get any help. Yeah.
Exactly. It's not about that at all. We use rating scales to help us evaluate whether what we're doing is working. So basically, I want to know, if you come in, Penny, and you've got a headache and you're saying, yeah, look, this is actually really bothering me. It's probably sort of an 8 or 9 out of 10. And I give you medication, some pain medication for that headache. I want within half an hour or an hour's time, you can say to me, yep, that's actually helped a lot. It's more like a 2 or 3 out of 10.
Yeah.
So that's what we're doing. It's not at all a test. It's just a way
it's very subjective.
Really subjective as well. And I'm not going to sit there and say to you like, oh no, but the way you're acting, you're probably more like a 7 out of 10. Like that's rubbish. You know, it's pain is what you report it and what you feel it to be.
Yeah. Yeah. Actually, there's been so many times that we've used those scales for kids.
Yeah.
And parents will be like, oh, no, they're this. And you're like, oh, like I totally get that, but we want the child, obviously age dependent, which I'm sure you'll go into in a moment. But it is the person experiencing the pain. It's their reflection, not anyone else's.
Exactly. And parents are always coming from a good place, and they're a valuable resource in the sense that particularly for younger kids. So if we just focus now on sort of toddlers, babies, children who can't verbalize and talk, or children with developmental delays or you know, barriers to communication, it could be really valuable for the parents to say, like, do you know what, they're just not behaving like they normally do, or you know, I'm noticing their facial expressions, they're just sort of furrowing their brow more than often, or they're a lot less active than normal, they're not wanting to talk. All that sort of information is really valuable to us, and we're going to sit there and be like, oh, but tell me what it is out of 10. That's, you know.
I don't know.
Yeah, it's not a quiz for you. And and as a parent, don't feel like you're being judged, or you've got to sort of come up with like, oh, it's really, really bad. You will always be believed. And also, just while I'm thinking about it as well, from being at triage, and I'm sure you've had this experience many times as well, Penny, it can be really heartbreaking if a parent presents with their child in pain, and you ask, oh, have they had any Panadol and Nurofen? And we're not asking that to judge you at all. We're just sort of wanting to know what perhaps has been given.
What have you tried? Yeah.
What have you tried? Exactly. What have you tried? And a lot of parents might say, oh, look, I didn't give them anything. I wanted you to see how much pain they're in. And it breaks my heart, because I want you to know that we will believe you. We don't need to see the child screaming in pain. The number one priority should always be to provide comfort to your child. And look, and if you come in and you say, yeah, look, we tried Panadol and Nurofen, they're a little bit better, but they're still not themselves, then that's good enough for us to know. And especially if a child has had those simple analgesias and that's not
not working, not relieving,
not relieving pain, then you need to be seeing a health professional. You need to be looking at what is causing that, and to provide pain relief as well. That's going to...
Absolutely. I couldn't agree more. I am so... and I think another side of that too is that sometimes parents think, I can't give that pain relief, you know, in case they have to go to surgery or something like that. It's like, no. Like, absolutely give it. We will sort that side of things out for you. But absolutely give it. If they're in pain,
absolutely give it. That, you know, that is fantastic. We're going to believe you. We're not coming from the sort of point of view of just sort of like, ugh, you're not really in pain, or you've already...
or like, I've seen worse.
Yeah, and we also know as health professionals that pain can change and fluctuate. You know, tummy pain, abdo pain, it can be really normal for a child to be bent over, 10 out of 10 pain, inconsolable, 1 minute, and a few minutes later they're quite settled and fine. And and the nature of some things that cause abdominal pain. So you're not going to be, you know, we're not going to think you're making it up. That is normal for it sometimes. So
totally. I couldn't agree more. I couldn't agree more.
And I guess like going into the thing of how the psychological and emotional aspects of pain can really impact kids as well. You know, anxiety can either really heighten our pain, can make it feel a lot worse, Or I think sometimes in children, it can really lead to them sort of underreporting what they're feeling. And what I mean,
Mm.
I come into hospital and they have a really obvious broken arm. You know, Joe Blow on the street could say, "Yep, your arm is broken." And I've seen it several times, and the child will be sitting there quietly. And if someone says, like, "Are you in pain?" they might just say, "No, I'm okay."
No.
They've
Are you
got a
like,
broken.
are you, we're not, it's out of fear of being touched
Exactly.
or, yeah.
They don't know what's going to happen next. They don't know what me as, the nurse is going to do to them. Um,
Mhm.
for school-aged children as well, particularly if they've just started school, they might be used to a teacher asking them a question and they're thinking, oh, what is the right answer? And so
Yeah.
they're sort of, are they sitting there being like, what is the right answer that I need to give this nurse? I might just say, no, 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 I'm not in pain.
Yes.
So, it's, and if a clinician was just sort of there being like, oh, they say they're not in pain and they've got a obviously broken arm, would you ever let an adult walk in and not have pain relief for that sort of thing? So yeah,
Yeah.
it's so interesting how fear and anxiety can cloud how we view pain or express it. So yeah.
Yeah. So actually, this just reminded me of something. I had a friend whose little girl started kindy, and her mum had mentioned that she had a high pain threshold, that she just didn't ever really get too bothered by painful situations.
Yeah.
And she fell over at school on the first or the second day of school,
Yeah.
and she actually broke her arm, but she wasn't that bothered by it.
Yeah.
And she was a bit upset and was saying, oh, my arm's really sore, my arm's really sore. And the teachers were like, oh, it's okay, like, we can call your mum, or like, what do you want to do? And she was like, oh, no, I want to stay. And she got
Yeah.
home that afternoon and her mum saw her and she's like, wow, like, this is really abnormal for you, like, what is wrong? Took her
Yeah.
up to hospital, broken bone. And I was like, that is so interesting. Like, and no
Yeah.
one did anything wrong, but that's why we value parents. Like, she knew straight away something was wrong. She's like, my child's not like this. But then it was so interesting that she didn't want to, either couldn't or didn't want to speak up in
Yeah.
that, no, it's actually really bad.
Yeah.
The kids can be,
Yeah, she didn't want to go to hospital or,
yeah,
at school. Yeah, it's
I
so
was distracted by everything else around her, and like, kindy is so exciting, I'm not missing out on this.
absolutely. And yeah, and that's probably a bit part of her nature as well, to maybe just be a little bit quieter about these things. She's not the sort of
stoic.
exactly a little bit more stoic, and someone who knows her so well, like her mum, would just be like, oh, no, this is
yeah.
But it's, yeah, absolutely. The teachers, it's not like they've, done anything wrong. They've sort of listened
No.
to, yeah, and watched her behavior, and she's carried on at school, okay. But yeah, it's really interesting.
So what on that, like, in terms of like being able to recognize pain?
Yeah.
I know it's different between like bubbies and toddlers and older kids. So like you mentioned a little bit before about like furrowing the brow, or what are some other things that we can look for as parents to recognize pain, or to even almost be like, maybe I should try some pain relief here. I think they might be in pain.
Yeah, absolutely. So, yeah, you can look at things. So behaviorally, are they quieter than normal? Are they more irritable? Like just a bit more whingy than normal, if that sort of makes sense. And it can be different. Like, kids also cry for a lot of reasons, and this is often things in hospital. We're sort of like, you could be crying because you're bored, you're hungry,
you're wet.
Exactly. Like, what can be going on? In saying that, I feel like parents know that pain cry.
Yeah. Or just different from normal cry.
Different from normal, or that kind of cry sends the, shivers up your spine. But it can be a lot more subtle than just crying and screaming and telling you, it just could be that they're a lot quieter. They're not, more irritable, more clingy, just wanting cuddles. And if you're used to having a little one that just runs around nonstop and suddenly they're just sort of sitting on the couch,
Yeah.
maybe they're not wanting to eat or
Yeah.
drink.
Or
Maybe
not
they're
wanting to be put down to walk or crawl or
absolutely they're not wanting to walk. Um, they might be holding their bodies in a different way, like they
yeah, yeah,
starting. So they might, it can be quite subtle. They sort of keep their arms in front of their tummy, for instance. And, you know, if you just went to sort of accidentally touch their tummy, they'd be, in a second, they're pushing your hand away.
yeah,
The way they sort of work to protect the bit
yeah,
that's absolutely, or not using their arm.
yes,
Yeah, things like that. Kids can actually be a lot smarter than adults in a lot of ways. I feel like if I've got a sore knee or sore foot, you sort of just carry on and you keep trying to push through it, and you're like, every time you're like, ow, that really hurts. But a kid will actually
yeah,
not do the things that aggravate the pain. They're not going to just like
yes.
keep
Like
running around.
us, like hunched over a laptop
Yeah.
going, I have no idea why my
Oh,
neck is so sore.
exactly. But a
Yeah,
kid would be not going to keep hunching over. I'm going to go and lie down, you know.
yeah,
But yeah, it's it is really complicated, and they often. I think sometimes when you ask really closed questions, like just like, does that hurt, or does this hurt, or is it sore? Sometimes that can work, and they can say yes, or sometimes it's better to be a little bit more open ended and just sort of be,
mm,
is there something about your tummy that you want me to know about, or
yeah.
there's
Or even
something
using words that they know,
yeah,
like Bernie or
exactly.
yeah.
You know what? I've got a parcel at my door. I'm just going to be.
No worries. Yeah, grab it. Easy. Jules, I just saw your message come through. It is really, really hard to know when to start investigating in terms of like from a parent's perspective. And I think this is why I always talk so much about tracking your child's symptoms, because you mentioned is it habit or is it anxiety rather than underlying problem? And quite often with kids with anxiety, it is not uncommon for them to say, my tummy is sore
Yes.
or head, mostly tummy, because they don't have those, and you would know so much more about this than me, Kim, but they don't have those proper like language skills to be able to even articulate what that worry feels like or what that anxiety feels like, and the only way that they can describe it is it's my tummy. So
Yeah.
I was just chatting about this message that Jules has sent through, and
Yeah.
I think the way to start investigating is to just write down as many symptoms as you can. And if your
Absolutely.
gut tells you to go to your GP
Yeah.
or emergency, whatever you feel you need to do, then you go and you just say, this is what's happening. I know it doesn't seem like much, but
Yeah.
this is not normal for my child, or it's happening a lot.
Absolutely. And tracking, like you said, writing things down can be really important, and thinking about things that might exacerbate it. You know, does this feeling get worse when they're about to go to school? Or do they get feeling when they're going, you know, they probably don't when they're having a day at home with you. Or, you know, that's if it is sort of maybe anxiety related. And like you said, kids might not be able to say, I've got butterflies in my tummy, or, you know, like I've got that nervous feeling.
Yeah, or I'm worried about
Yeah,
leaving you at the gate, or plus I
absolutely.
think as well to mention with this too, especially with school, and I feel you on this, Jules, because Rex is exactly the same. When because he's done the same thing before, is he said that his tummy's sore, and immediately from what I found on when I reflected on it was I was like, oh no, like, are you okay? Like, come here, let's have a hug, talk to me about it. Like, I dropped what I was doing to interact with him and be with him and have that one-on-one. And part of me thinks there's a big possibility that whenever he was feeling lonely or worried or just wanted me, it was a way for him to get that connection. And that's really clever, but then you sort of, it takes a little bit of, it's hard to work out, is your tummy actually sore?
Yeah.
Or is there something else? But either way, like you mentioned earlier, the number one thing you want to do with any mention of pain is comfort, like first up. So maybe it is that emotional comfort.
Yeah, and validating their feelings as well. It's not
Yeah,
about, you don't want that sort of toxic positivity, like, oh, you'll be fine, it's okay. Yeah, acknowledge, like, oh, I can see you're uncomfortable. I can see that this
yeah,
is hard. That sort of thing is, I think, really important.
yeah.
And yeah, and back to the sort of the tracking of, what was my point? Tracking of things. You can also sort of write down, we tried Panadol today.
Yeah.
It didn't help. And this is all really good information to be able to chat to your GP or chat to someone in ED.
Hmm.
Well, talk about things that you might have tried to help, or maybe
Yeah.
hack. Lots of little things that you've tried, or you've tried distraction. Yeah, good
Or
to sort of,
like this, like Jules mentioned, when do the symptoms start? Like what was happening
yes,
before or during,
yeah,
or are you about to go to work, or like what is it?
yeah,
And they might legitimately have like pain for that, and it's not up to us to be like saying, well, that's not pain, but it's helping sort of work out where that's coming
I
from.
mean, absolutely.
Yeah.
Or even tracking symptoms like, have they opened their bowels today, or
Yeah.
like, there are lots of different components. Finding the source of pain can be really difficult.
Yeah.
It's not always cut and dry. It's not always that broken arm that you can just point to and say, yep, done. And sometimes children require a lot of investigations, and we still may not be able to come up with a definitive answer.
Yeah.
But regardless, sort of tracking and acknowledging what is working to help and what isn't is still really important. And what makes
Yeah.
it worse. Yeah.
Yeah, yeah. And then as well, like you said, like it can take a while to investigate
Yeah.
what's going on. And I know so many times with GPs, they're amazing at almost just sort of ticking off the really obvious things first.
Yeah.
So you want to go through that. Is there a medical cause? Is there a surgical cause? We're going to like tick off all of the big things. And then we start getting into the grayer, sort of more, is it
Yeah.
emotional? Is it psychological? Is there something else that's not as obvious as,
Absolutely.
yeah, and all as relevant as one another, none more important or less, but just trickier.
Absolutely. Absolutely. And that's what emergency is also really good for. They can go through, tick off or eliminate the
Mm-hmm.
more life-threatening things, more dangerous things, and sort
Yeah,
of they that reassurance that it's maybe not appendicitis or other things that could be going on.
yeah,
Um, so they are really good at sort of eliminating all those things. Sometimes in ED you may not get an answer as to what it is, but regardless of all that, your child should still be given pain relief
yeah.
to make them comfortable.
Yeah, for sure. And then they can sort of, it's almost like there's multiple safety nets where, yeah, you could go to emergency for that immediate, like
Yep.
you mentioned, they were doubled over in pain in their tummy and then it went away. And you're like, of course, it's like these magical emergency doors that people walk through and it instantly resolves. Like,
It
we get
happens.
that, it happens.
I just feel like giving them a hug. I'm like, I know, I believe you. I'm screaming in the car all the way here. Like yeah.
Yeah.
Sometimes I have that effect of the kid is just like, oh, where am I? Like, what is? Yeah,
Yeah.
yeah,
Or being out in the cold or like whatever
yeah,
it is. But then they can then get all of those investigations, whatever results they had back, and be like, right, go back to your GP now because it's not an emergency situation, but go back, see your GP. You've got all of these things now, and you can continue your investigation there or refer on to like another specialist or something, and continue it just slower. That's all.
absolutely,
I should
absolutely.
say slow. It's not slow. It's just there's a more steps involved.
Yeah, yeah, exactly. It's a complicated problem, and it's really tricky sometimes. But
Yeah.
never, and maybe we could get into this now about why there are barriers sometimes to giving kids.
Yes. Yeah, that's really good. Yeah,
Yeah,
barriers to why giving it, and then what can we give kids for
yeah,
pain?
absolutely. And I think, like we've already sort of touched on this, that kids might be being poorly assessed or under-assessed, or their pain is sort of underrated, and sort of people are like, oh, they seem fine, they seem all right. That's
Yeah.
probably definitely quite a common barrier in hospital settings. Or if you are going somewhere that perhaps they're not used to seeing children a lot, or that particular nurse or is more of an adult nurse or doctor, I think sometimes they can feel a little bit nervous to give stronger forms of pain relief.
Yeah.
They Here I'm saying they shouldn't feel that way, because we do know it can be safe. We dose children according to their weight. It will mean, of course, that the child will need some closer monitoring, but
and there are other risks with those medications, but
absolutely,
the staff are trained to
respond to that. Absolutely, yeah. So it's if Panadol or Nurofen are not strong enough to deal with your child's pain, it's completely reasonable to think about maybe an oral opiate, maybe something like oxycodone, or in a sort of acute, moderate to high sort of pain situation, children could do really well from what we call intranasal medications. I don't know if you
up the nose. It's so cool.
Up the nose. So again, this is when if we're just sort of going into we're in an emergency department, and your child's in, a significant amount of pain. It can be really effective to give some medication that we squirt up their nose, with something called an atomizer, which kind of just makes it into a bit of a spray. But it's all that the medication can be really quickly absorbed and work really quickly. So this is often a great thing that you sort of see if you're coming through triage, you've got a bad fracture or bad injury or burn. Absolutely. Quick spray up the nose. And if you've come by ambulance, your kid might have also been on the green whistle as well.
Yeah.
Which is a form of pain relief, and can make them feel a little bit happy. But yeah, a quick spray up the nose is kind of like a good, gives us a chance to maybe think about getting some IV access, to sort of buy us time. We don't want the child to be suffering, essentially. We can give that medication, and that typically might be medications like fentanyl or ketamine, which might make parents feel really nervous, but and drugs like ketamine have sort of social connotations and things like that. But just know that in the hospital setting, they're being given in appropriate doses for your child.
And monitored effectively. Yeah.
Absolutely. You're not just sort of being given some ketamine up your nose and told to sit in a waiting room. Your child will be monitored properly. There'll be an president. But it can be a really quick and effective way to reduce really severe pain quickly.
Yeah, for sure. Yeah.
Other barriers, I think a lot of the times maybe oral medication refusal. And this is a really hard thing for parents. They might just say, look, I cannot get Panadol into them. And I know you do a lot of work, Pen, with, talking about taking oral meds. It can be a real struggle for parents, and I really feel for them. And, in a hospital setting, we can work with you as a parent to try and find a way that we might be able to get this oral medication in. Sometimes you could even look at giving ER Panadol. So up the bum, unfortunately.
Yeah, actually, I did a post about that the other day, and I found out since that there is like a national shortage of PR paracetamol. I was like, no, because it is a really great alternative for kids that can't keep it down or refuse to take it, or
exactly, refusing to take it. So that's definitely a barrier that we can see to children getting good analgesia. What could some other barriers be?
I guess sometimes with younger bubs or chubby bubs or infants, often will go to get intravenous access and can't. Like we can't get it, or it comes out, or they rip it out, or all of that sort of thing. So kids.
I know, that's really hard. And also talking about access, you're also doing a painful procedure to get that. So it's really hard, and that can be really for kids to be like, look, we can take your pain away, but it's going to be after we put a needle in, which which sucks, which is
makes no sense, but
makes
long-term gain.
and as adults we can really rationalize why we need to do that. Short-term pain for long-term gain, I guess.
Yeah.
But yeah, I think it's really important when you're in hospital to be honest with kids, but in an age-appropriate way as well. And but also that the doctors and nurses are going to do everything they can to help take the pain away.
For sure. Yeah, so interesting. And I think I did get quite a few questions that came through, but most of them you've actually answered already. There were a couple of sort of specifics in how do I know if it's ear pain, or how do I know if it's, and I think it's going to be different for every single child. But I think the biggest thing, like you mentioned, is just their behavior in what they're doing. Like, are they waking up more during the night when they're typically, I don't want to say good sleeper, but they typically sleep through the night, or are they pulling at their ears, or just acting differently to their normal?
Absolutely. And things like ear pain can be really tricky to pinpoint, or, a sore throat, especially in children that can't tell us. Pulling on the ear is a really good, obvious one, but sometimes it's a lot more subtle than that. And, to be honest, there's even times where I don't even think that is a source of pain, and I might have my best friend be like, it's probably his ears, or, it's just things that you don't think about. But when you see your GP or come to hospital, there is going to be a little checklist of, we're going to have a look in their ears, we're going to look in their throat, feel their tummy, maybe catch a urine. Is it a UTI that sort of they're presenting like they've got tummy pain, or the different sort of causes. And it's, I guess, for parents not to put the pressure on themselves to be like, oh yeah, I know exactly where this pain is coming from, like bang. But you literally just come to hospital or come to your GP and say, oh, I don't know, just something's up. They're not themselves, and I worry that they're in pain. So
for sure, absolutely. And I think that's such a good point to make, is that it's not up to the parents to have to diagnose, but it's also you can seek help when you don't know what it is, but something's off, trust yourself. Don't ever ignore that. It's better to go get help. They do all the checks and be like, no, everything looks okay right now. And you're like, sweet, that's fine. Everyone's happy. Like, there's not going to be a time that someone's like, oh, shouldn't have come in for that. Like, no.
You should never be made to feel that way. That's what we're there for. We're there to help you and to help your child and to minimize suffering. So
for sure. And sometimes it does happen, but it's more about that particular clinician is having a bad day. No excuse. There's no excuse for it, but don't make it impact you not getting help next time, or thinking you did the wrong thing. Like, never ever feel that way.
100%. And I guess we haven't really touched on things like previous experience and how that can influence pain and anxiety. And it can be really typical for kids to have had a bad previous experience. Or I'm petrified of hospitals, I was held down and had, a needle. That can be really good information to tell clinicians when you present, if that's the case for your child, because it's something we need to take into account. Sometimes you need a sort of circuit breaker of a really positive experience. You absolutely can turn it around. I don't want parents to feel like, oh my God, my kids had a horrible experience. They are going to hate hospitals for the rest of their life. It's going to be terrible. I have worked with some children who are off the scales, needle phobic, or, had severe hospital procedure related anxiety. And it can take time. I'm not going to say there are any sort of quick fixes, but it's absolutely something you can turn around and come back from. It will probably take work involving, psychologists, definitely talking to your GP about, and if your child is coming to hospital frequently, this should definitely be a conversation that's ongoing with providers as well. And child life therapy.
Yes, they're amazing.
They are incredible, absolutely incredible. Their roles in terms of preparing a child for a procedure or
Talking
comfort,
to them.
yeah, absolutely. Supporting them through the procedure, so actually being that distraction or support, they are invaluable. And also debriefing at the end. It's not just about sort
Yeah.
of done, let's all leave. It's about sort of helping the child to understand what just happened and how are they going to frame that experience.
Mm.
If it is possible in your hospital setting to engage their services, oh, absolutely do it.
Yeah.
It
Yeah,
can
they're not there at every hospital.
no,
But yeah, if they're available, yeah, do it.
absolutely, and absolutely use them if you can. But in saying that, if they're not there, nurses and doctors who work with kids do all of that stuff, I think, without even realizing it. They're great at the language they use, the way they position kids.
Yeah.
We use things like topical analgesia, Angel or Emla cream that people would probably
Like
be.
numb it. Yeah.
Absolutely. There are so many times that I've seen a child getting a drip put in this hand over here. They're over here on the iPad and they have no idea that the drip
Yeah.
is, it is the power of distraction.
Yeah.
Is really incredible with kids. Kids have such rich imaginations,
Mm-hmm.
even down to things like even perhaps for sort of school age or even teenagers, sort of guided imagery or putting your headphones on,
Mm.
music. Anything that can kind of help from that comfort,
Yeah.
coping mechanisms, deep breathing. I think, if people think about us blowing bubbles with kids, I think a lot of people are just like, oh, you're just trying to entertain the kids, which we are.
Yeah.
Um, but if you turn it around and say to the child, can you blow me some bubbles? What that can actually encourage them to do is take a nice long exhale as they're blowing the bubbles.
Yeah.
All know, it's very sort of popular in culture at the moment about how breathing can impact our anxiety, our heart rate. So getting that child to sort of be like, oh, I'm actually going to blow some bubbles. They're slowing down their breath, taking long exhalations. It can all help with anxiety as
That
well.
is a brilliant idea. That's
Yes,
so simple but so
yeah,
effective. I'm
absolutely.
going to use that for
Yeah,
sure.
definitely. Yeah, and of course, like, how many times have you been blowing bubbles, Penny, for someone, and suddenly you're just like, oh, I feel like
Someone else take over. Yeah.
exactly. Yeah, I mean, but that is all part of sort of just calming down our nervous systems and
Yeah.
give it to the child to blow the bubbles. Yeah, can be
That
really
is
good.
so good. Oh,
Yeah.
I honestly could just sit here and chat to you all day about this. I find it so interesting, and I think it's, if anything, I just want parents to take away that it is complex, it is
Yes.
tricky to navigate, and we really rely on you to help
Yeah.
us
Yeah.
understand. So if you're struggling to understand it, we all are. Don't worry. Like,
Exactly.
we all are.
Exactly. We're all here to help you, and don't be afraid to advocate.
Yeah.
Just this isn't right. This, my child just isn't right. And we are all trained in pediatrics to listen to that parent that
Yeah.
says, oh, I just can't put my finger on it, but something's just not right.
Totally. I totally agree. Yeah. Yeah.
Yeah.
Oh,
So
thank you so much. I'm sorry. Oh, you just
you don't
paused.
need to be the expert. Oh no, can you see me?
Yeah.
Yeah, yeah. You don't need to be the expert. You're the number one advocate. Yeah.
Absolutely. Like, you are the expert in your child. So
Yes.
speak up. Like,
Absolutely.
you are part of the team. Like, you're a huge part of the team.
100%. Yeah. Yeah.
Yeah. Oh, thank you so much. And thanks everyone that joined us live. I'm obviously going to say this is an IGTV, and if anyone has any other questions that is watching it back later, just pop it in the comments and either one of us can get back to you. But thank you for your time. I really appreciate it.
Thanks, Penny. It's so lovely chatting.
Yeah. And we'll chat again soon.
Yeah. Awesome. Thank you.
Bye. Bye, everyone.
Bye.